Do I need to do an intro for you, Dr. Joy? No, you're good?
No.
This is Dr. Joy, everyone.
Yes, thank you. Oh, I think I always have technical difficulties when I present. Sometimes the slides will jump, sometimes the slides will go backward. And this time, there's no pointer.
The pointer?
Thank you.
We're good?
Yes. Thank you so much for inviting me to participate in this year's meeting again. Yes, we're familiar faces, and it's always good to meet up and be here. So, this is going to be a very short presentation so that we will have enough time for our discussion. But I'm hoping that after this short presentation, we will have a better understanding of the current delivery of medical and allied health services to our children with NPC. And I'm hoping that with this information, we will be able to have a framework for the discussion in the workshop. I will also give an overview of the metabolic service in its state. But before I start, I'd like to acknowledge colleagues who willingly gave information about their unit. And these are the different colleagues who willingly sort of immediately answered my email when I asked some questions. Thank you so much to them. Now, as we all know, there's a variable age of presentation for NPC from the fetus to the adults. And then also, we know that there are variable signs and symptoms depending on the age, such that these signs and symptoms will also overlap with other conditions, such as infection, so contributing to the diagnostic delay for our children. And this is just a list of the different doctors who will see our child with NPC. These doctors might be the initial doctor, they might be the second, the third, the fourth doctor by the time our child is seen. And then also, there will also be varying degrees of level of knowledge and at the same time experience for NPC. So, when NPC is suspected by these different doctors, the pathway would usually be a referral to a metabolic specialist. So in Melbourne, for example, if it's a pediatric patient, the Royal Children's would be the point of call. And then also for the adult, it will be the Royal Melbourne Hospital. Now, what happens? What's the role of a metabolic specialist? The metabolic specialist will organize metabolic and genetic tests to further confirm the diagnosis of NPC, and then also consider treatment, do the genetic counseling, and then also the metabolic specialist will refer to other doctors, to genetic counselors, and also the allied health services. So as we can see, we have a child with NPC, there would be many doctors, many allied health who would be also involved. I would just like to pinpoint the psychiatrist. We know that's Professor Mark Walter Fang, who's a very important person in the NPC community here in Australia. So, going to the different metabolic service in the country. So the first one would be the New South Wales. They have a metabolic network service. So they have the Children's Hospital in Randwick and also the Children's Hospital at Westmead. I think they have the biggest metabolic service in the country. And as you can see, it's mostly a public delivery of service. And is there provision for private service? Yes, but only admissions. And also, the funding for the Miglostat, since it's not PBS covered, would be hospital-based. And then in Queensland, so there's 2.4 FTE, so that's full-time equivalent. And also we have the nurse, they have the nurse practitioner, the fellow who's in training to become a metabolic specialist. And also, they also have social worker, dietitians, and so on. And they have a public or private setup. Yes, they do have, and they have provision for a private service. So every metabolic service may have mainly just public, no private, but some will have some provision for private service. But as you can see, the funding for Miglostat is only for the children. And there's a Queensland start and stop criteria, and this criteria is similar to the one that we have shared to the NPC Foundation that was organized, and all the different metabolic units in the country put in some input. So there were representatives from each of the unit. So Western Australia, they have 5 metabolic consultants, but as you can see, it's only 0.2 full-time equivalent. So there's actually, in effect, just 1. And as you can see, it's also public, and there's provision for private service, but the funding for Miglostat, it was unsure. Okay. Now, the next one, South Australia, and South Australia is very important in that we send all the samples for investigations for lysosomal storage disorders, including NPC. So they also have a 2+1 pediatric gastroenterologist. They have a fellow, and also their setup is also mainly public, and there's no provision for private service. And then the funding for Miglostat is also for from the hospital. However, I was informed that they need regular, like every 6 to 12 months assessment for the funding to continue. Now, lastly, our service, we have 2.9 full-time equivalent consultants. So we have a shared service. So meaning we shared patients. We don't see one doctor will not see one specific patient all throughout. So there would be a team of doctors who will be seeing a patient. And we do have our nurses, our social worker, and we're mainly public service. And we're mainly based at the Royal Children's Hospital in Melbourne. And then in terms of provision for private service, there's none. So we don't do any private clinics or private services at all. And then in terms of funding, yes, we do have funding, but this entails application to the Hospital Drug Usage Committee, and we have to submit assessments every year, and sometimes you can be given a certain duration of approval, so that after that approval will elapse, you have to apply again. So that's the process currently in terms of the delivery of service, the availability of the treatment, and within the country. Thank you. Short and sweet, right?